Here in Washington, President Trump and top health officials are optimistic that a vaccine could be ready by the end of this year. And today, an about face from Vice President Pence, who wore a mask just days after he was hit with criticism for not wearing one at the Mayo Clinic. CBS's Weijia Jiang is at the White House tonight. Weijia?
Honora, Second Lady Karen Pence says Vice President Pence did not know it is the Mayo Clinic's policy to wear a mask until after he left the facility on Tuesday, even though the clinic says he knew beforehand. Today, the vice president did not talk about the controversy, but his actions made a statement.
Today, Vice President Mike Pence offered an apparent mea culpa in the form of a face mask. He wore one while visiting a ventilator production line in Indiana. After receiving backlash earlier this week for not sporting a mask at the Mayo Clinic. In Washington,
I'm in charge.
President Trump took ownership of Operation Warp Speed, the administration's ambitious effort to make 300 million doses of coronavirus vaccines available by the end of the year.
I'm not overpromising. We're going to fast track it like you've never seen before.
Instead of waiting for one vaccine to emerge as a success, health officials will identify the most promising candidates and start manufacturing early. Dr. David Agus is a CBS News medical contributor.
So there's risk here. That means choosing in advance which vaccines you think will work, putting capital at risk, manufacturing them with the hope that they work.
At least 120 projects around the world are working on a vaccine. So far, a research team at Oxford University has been most successful and fastest.
This is more like 18 weeks rather than 8 years.
Dr. John Bell says human trials started last week and results could be available as early as mid-June. Oxford has already partnered with pharmaceutical giant AstraZeneca in case the vaccine works.
That probably earliest time that we can probably scale manufacturing would be the beginning of July. But the intention is to make enough doses so that were it approved in, say, September, we would actually have 30 million doses.
Meanwhile, the U.S. intelligence community announced it does not believe the virus was man-made or genetically modified, but it will investigate whether the outbreak started by accident at a laboratory in Wuhan. Tonight, President Trump said he believes it did come from that lab, but said he's not allowed to say why. Nora?
All right, Weijia, thank you.